You know, one of the procedures that's become one of my favorites nowadays is smart liposuction of the neck. Smart lipo really does contribute something to the procedure when we perform suctioning, liposuction that is, of the neck area. I have been really enamored, I'm in awe of the results I'm getting. It's the hottest procedure in my office right now, and I think that this case actually helps to demonstrate it. Here's one more example of a young woman who was disappointed in her profile and frustrated by her neckline. She really felt like she was younger and in better shape than she appeared to be from the neck up. I'm not showing you the rest of her physique, of course, but she's a relatively slender woman who for some reason just seemed to have a little extra something right here in the neck area. So smart lipo is done in my office with some local anesthesia only. It's not much different perhaps than going to the dentist. I feel the need to tell you all that to date, I have never had a single complaint about pain, discomfort, swelling, nothing. Patients really do very, very, very well with this operation. And if you look at the example on the screen, this woman did very well in terms of her neckline, the contour of her profile, the definition of her jawline. If you look closely, you can see what my surgical plan was on the before side. I intended to try and define the edge of her face, really, to define the difference in skin quality between her facial skin in the cheek area and the neck skin. And honestly, without this blue line here, you really couldn't tell where her neck started and her cheek stopped. Whereas in the after, and by the way, this is only 4 days later, you can clearly see a nice delineation. Her jawline is well defined. She really did very well. Granted, because it's only 4 days later, we can see some black and blue in the area, but believe me, that's going to go away pretty quickly. I know this woman, and within about a week or so, the remaining black and blue really did improve dramatically. She specifically complained about this area under her chin, where she felt like a bullfrog, is the phrase that she used. And she said that she felt like she was always full in this area, and she thought it added a lot more weight to her persona in general. Post-operatively, only 4 days later, she's got a nice, flat, giraffe-like neck rather than a bullfrog, and she's very pleased with that outcome. She tells me that she feels much better about herself. She has a great deal more confidence. She doesn't wear turtlenecks as much as she used to. She's really very happy, and I think it's made a major improvement in her appearance. So I think that this procedure is actually beneficial for a lot of patients, even those who don't realize they would do well with it. I have patients who come to me and they are thinking about full facelifts and neck lifts and much more involved operations. As I mentioned, this is something that's done under local anesthesia in the office. Patients are awake, and it only takes about 45 minutes. I think that most people are very happy with the outcome, and they're very pleased and surprised at how simple it is and how easy it is to do.